Good morning, everyone, and welcome to another episode of Broken Beautiful Me Stories of Hope, Gratitude, and Resilience. Today, I have a special guest, Professor Brent Moore, and I'm so happy that he's here because we're going to have a wonderful chat. He's an accomplished educator and mental health professional with over 15 years of experience in higher education and counseling. He currently serves as chair and professor of behavioral and health sciences at Indiana Wesleyan University, with expertise in curriculum development, online and hybrid course delivery, and program leadership. He's a licensed professional counselor with a strong background in research, publication, and clinical practice. Skilled in integrating theory and practice across diverse learning environments with a focus on leadership, ethics, and multicultural counseling. He's committed to fostering student success and advancing the field through innovative teaching methods and ongoing professional development. Brent, welcome to the show. It's so nice to have you here.
Oh, thank you so much for having me. I really appreciate it. It's good to be here this morning.
So, just to begin with, if you could, for our listeners who maybe don't know about your work, can you share a little bit about your background and the work that you are currently doing?
Sure. I think a lot of people, when they hear the word work, they go straight into their work accomplishments, but I would be nothing without my family. So I tend to start there and work the other direction. So I do have two kids that are living. One has passed away. We have an 18-year-old. Her name's Mia, and she is off to college right now. So we're going through the pains of losing her and then moving to just a three-person household from day-to-day activities. And our son is 12 years old. So there's a large gap there. And then Marley, who passed away, would be 16. So they fill a little bit of that gap that's there between the two kiddos. But that's a huge part of my life. My wife and I have been married for over 20 years, and it seems like it's gone by so fast. So
Yeah.
it's all good times, though. I really have a lot of varied interests, and academically, I started off looking at the realms of spirituality and psychology and how to integrate the two. There's I think things have changed a lot just in the time that I've been working in terms of the latitude people are willing to give to that integration between spirituality and clinical work. So
Mhm.
I think it's a very important aspect to do holistic care, to look at one's spiritual and religious background in the counseling process. Others may disagree with that. So it's kind of an interesting time within the field of counseling in that regard. But I was a visiting scholar at the University of London over the summer, and I took the family along for that, and that was a whole bunch of fun.
Yeah.
I do have a background in educational diagnostician. I have an MBA, but I've also done more graduate work in psychology and biblical and theological studies. So it kind of a strange background, I think, but at the same time, it makes for good conversations like this. So, yeah.
I think that's great. I think when, because I have a very varied background as well, I've done a little bit of everything over the years. And I just think it gives you wonderful, wonderful perspective, right? You can kind of see things from different angles. And I love that you are looking at the intersection between kind of that clinical approach and then the intersection with spirituality. Because so many people, their faith when they are struggling is a huge part of how they deal with things, and it's that faith is not, some people have beliefs of like an organized church religion. Other people, their faith is in nature, and so understanding all different approaches to that. And culturally how people deal with difficulty. It truly is a holistic approach. I love it.
Yeah, yeah, and when one is to your words when we were talking before, the recording started, the word broken really is highlighted, I think. And in that brokenness, what do you do with your brokenness? When you maybe have exhausted all of the resources that you usually call upon, what do you do at that point when you're totally, completely exhausted and have depleted all of those things? Uh, and I think AA really nails it on the head with starting off with a higher power. Like there's something that is in the ethos that we need to be able to call upon in order to say, I can't do this on my own. I can't make it through this on my own. For me, that's Jesus Christ. For somebody else, it may be something different. But I
Mhm.
think having that framework is a good start to help give people hope. Hope, hope,
Right.
and another thing that we'll probably touch on this morning is meaning as well.
Yeah, that is so true. It's like a grounding force, really. Because when you are going through really dark days, it is a normal feeling to feel alone in that, and faith kind of makes that bridge for you back to your community. Um, just to jump back into your academic work for a second before we continue on that line, but I do want to circle back to it. Tell me about the Neural Pathways Learning Center, because I'm very curious to understand the work.
Sure. I did clinical work of counseling and therapy for about 10 years, just as a licensed professional. At the school I was working for at the time, they offered postgraduate certificates. And I thought, why not do those? That would be helpful to either one, help me find a niche within the work I was doing, and also help my students who I was supervising at the time, because students would often come to me needing help with their clients who are children,
Mhm.
and children scared me to death. So it's like, what am I going to do to help a child? So I did the play therapy certificate, which really gave me a good grounding and understanding of techniques to use with kids to help them work through. It could be grief, it could be loss, it could be anxiety, it could be coping with ADHD or a diagnosis. And so that was very helpful. And then there was another certificate program, which is completely different from play therapy. It was in sexual addiction work. And so I got a deeper understanding in that. Well, after I did that certificate, I kind of became known as the guy around town that helps with um, people who were going through infidelity, or if there were pornography addictions or any other kinds of substance use or vices that people had. And those cases became really tough. And my hat goes off to all of the counselors and therapists, social workers, psychologists, you name it, that help people through these issues, because their stories can be very, very heavy. And you take
Mm.
whether I think a lot of times I was taking the work home personally with me, and thinking about people and having a hard time focusing and being present in the moment. And so in talking with my wife, and COVID happened at the same time, it's like, why don't I take this time to sort of reinvent the work that I do? We had our son tested for dyslexia and specific learning disorders when he was in the fifth grade, or I'm sorry, in kindergarten.
Mhm.
He was about 5, and he um, was in a really bad spot in terms of where he was at in his growth and development and reading. And so that was a very challenging appointment for us, but it was very helpful at the same time. And it
Mhm.
was also very expensive too, to do private testing. So I
Okay.
thought, why not start a service for people who live in my community, charge a third of the price, and offer this service that also gives me a sense of accomplishment at the
Yeah.
same time. So I went through another program and got an EDS, an educational diagnostician. And so
Mhm.
neural pathways really serves as a force to help, a resource to help people who need diagnostics for their kiddos, either in psychoeducational testing or just educational testing. And we've been able to help a lot of families with dyslexia where that's shown up, or if there's not, be able to give people another um, batch of strategies to pursue that will help the
Yeah.
child. Yeah.
That is absolutely beautiful that you see that this is cost prohibitive and you've created something so that these children still have a chance to find out and find tools that will help them in school. I'm sure the parents must be just so grateful to you for that because it is. Cost does prevent us from getting the help that we need sometimes. So thank you for doing that. That's such important work.
It's a wonderful, I call it a side gig because I work full time as a chair of a department in a school in Indiana, and I live in Kansas City, so I do that remotely. So I'm in this space a lot, which is in my basement at home. So it gives me the opportunity to get out of the house and you know, experience life with other people and interact in person with people, and so it's a lot of fun. And then the takeaways that I get from that time, I can use those as examples for the students that I teach too.
Absolutely. So what have you observed about learning and children since COVID?
Mm. Yeah, I think that COVID is kind of a hallmark of isolation and being alone. And I think we can see some of the consequences of that. For some people, being at home isn't a safe place. And so, you know, it maybe offered a chance of respite for some. For others that maybe were already inclined to be in isolation, it just furthered um, um, that direction. I think that we're all created to connect, and like we are relational beings. And so, you know, keeping people, I understand why they were in place. So I'm not arguing the rules or what was put in place or the protocols or the structures, but from a design standpoint, I don't know that humans were designed to be X amount of feet apart with masks covering their faces and not being able to see the full range of emotion. It just seemed like it was, especially if you that was a formative age for growing up and understanding social cues. That is a really the tough place to be, and I think we're seeing the outcome of that even now. And a lot of people lately have been talking about the Anxious Generation book by Jonathan Haidt, and I think that you know, some of his data on the spike of anxiety uh,
Mhm.
in 2010 when the smartphone was released was telling. And I also
Mm.
think that when the social media apps were introduced on those smartphones is telling. But I think now we're starting to get data that's, you know, having to do with the impacts of COVID and how they've affected us socially. And so I want to say, like, I think that being able to interact with people without any kind of coverings or spaces between really helps us in the navigate like the social engagement system if we're using the polyvagal theory, for example, right?
Mhm.
That we can interact with each other and know if this is a safe relationship or if it's a threat, to be able to move away. All those cues are just a lot more obvious and clean, and it just is more helpful that way. But I think you see a lot more people swiping on phones. I was at an airport yesterday and just looked around, and everybody had a phone in front of them and they were swiping. I think there was maybe one person that didn't out of like 100 people that I scanned the room. So
Wow.
yeah.
It's, one of the things my younger son, well, both my sons were hockey players, but my younger son, I remember him being he traveled a lot. So we drove all over the country for these hockey games. And one of the coaches that he had, so we would go out for dinner as a team dinner, and he always asked for the bread basket, and that's where everybody's cell phones went, because he wanted them to look each other in the eye and know each other and trust each other. And that was one of the best teams that Brendan played on, because they actually went to the national championships because they gelled together as kids. They trusted each other. They weren't, looking at their phone at all the distractions. So what could you say to parents then? So that we were, kind of, COVID is still very much here, but we've kind of gone back to our normal routines for the most part. What would you say to parents who still see their kids struggling? Like what's a tip that you could give them to maybe help them move forward?
Yeah, it's funny too. Just hearing you ask the question, the perspective of the therapist often for receiving a child in therapy. Oftentimes, therapists are looking at the parental system to get cues on what's happening in the system and going on. It's almost as if the parents will say, "Here's my child, fix him or her," and then the session moves forward. But really, I think when you take a step back, there's systemically issues going on that also involve the parents, which the
Mhm.
parents end up becoming a really important part of the clinical puzzle of putting things together. And I think that as parents, we do a lot of modeling with our kids, even especially with cell phones and the way that we scroll or pay attention or don't pay attention. And so I think for those listening, it's, knowing yourself in order to impact the person that you're thinking about or in your family that needs help, or maybe they're the scapegoat, for example, but it
Mhm.
might be actually a personal problem, so paying attention to the subsystem even of the couple is going to be important too. So making sure that they're spending time together, where they're both experiencing physical intimacy, emotional intimacy, spiritual intimacy. There's all of these different types of intimacies that, if I had to guess, they're probably nobody's perfect. They're probably needing help in one or more issues of those categories. But that ends up having a huge ripple effect to the child, him or herself. So I
Mhm.
think taking a look at the larger picture is paramount in those types of situations.
Absolutely. I recently interviewed Dr. David Rico, and he just released. Well, he's released a number of books, but he's released a book called "By Your Side,"
Mm,
and in that book, he talks about soul allies, and those people who surround you. And it sounds like that you're basically saying kind of this similar thing: the people that surround us and support us in our life, and seeing that full picture so that we can then move towards healing or health. But it's pretty much impossible if you can't see that full picture, right? You need to know the backstory.
yeah, absolutely. An example of that is last night I was talking to a supervisee who's doing like post grad work, and she was talking about a mom who was bringing her daughter to counseling with diagnosed with ADHD. And we were talking about the relationship between mom and daughter. Dad's not in the picture, but he's still around. But she spends some time with him on some weekends and that sort of thing. It's really, really hard to help someone. You can't really talk your way out of ADHD. The symptoms just don't go away. So, as therapists, we're talking about coping skills or strategies to help with the symptoms and that sort of thing. But if we can't have a conversation with her dad, it is really limits what can be done therapeutically because there is so much strong interplay that happens between session to session when you're only spending an hour with someone once a week. we've got to be able to carry through some of the structure and things that we've contracted on with the kiddo, with parents, to make sure that those are getting followed through. So I think that that's an example of
Mhm.
this being able to include the whole system, but not always being able to follow it through from a realistic standpoint, given the circumstances.
Right, right. Um, okay, so I want to jump back a little bit about and talk a little bit about healing and grief. Um, I recently talked with someone about the gifts of desperation and the wisdom that can only really come from pain. And I know that you and your wife lost your second daughter, Marley, to cancer, and that was about 13 years ago, I believe.
Yes, yeah. Yeah,
Yeah. So
we're coming up on it this Friday, actually. Today's Tuesday, and so this Friday will be 13 years.
okay, and I'm so sorry for your loss. Um, can you speak to the lessons learned during this time? I myself am a bereaved parent as well, and I just want you tell us about Marley and tell us about some of the wisdom that you have from your journey.
Sure. So, our firstborn, Mia, is like a unique kid. She is like every parent's dream child. I think we were ready to write a book on being a good parent because we thought we attributed all the things that she was to our parenting skills. But come to find out, number two was a big shocker. And with Marley, she's a stinker, and there was a lot of active parenting that needed to happen with her. And they don't even look alike. And our third born looks just like Marley. So the two of them are like spitting images of each other. And then you've got Mia over here who's falling into line, doing everything she's supposed to do. And it's just a funny dynamic. But I think lessons learned, it was really fascinating for me to be studying behavioral and social sciences, especially psychology, and getting degrees in psychology and thinking that I have it all together, but having never really experienced depression before, or
Mhm.
even anxiety, to a degree um, that's unmanageable. Those kinds of things I had never truly experienced before. And then hearing of Marley's cancer diagnosis when she was 18 months old just shook my world. And I ended
Mhm.
up, everything psychological is simultaneously biological. So taking medication was important for me, to help deal with the depression. It was a really challenging time. I don't want to make it about me personally. At the same time, I would be remiss if I didn't say I was going through a doctoral program at that time and working on my dissertation, and
Mhm.
I couldn't focus. And there's just for clear reasons. And one of the things that I would say too, as a parent, it's really hard to watch your child suffer. And so we know that amazing things can come from suffering, like you said. But if Marley skins her knee on her bike, like, it's really hard as a dad because my mirror neurons are firing. I'm empathetic. I'm trying to feel what she's feeling. Something similar like that happens in the cancer diagnosis, and you start to feel what she's feeling, wanting to feel what she's feeling. You want to validate what she's feeling and try to understand what she's feeling, and you sort of take on that pain. And you can only do that so long. I mean, the person enduring the pain themselves, it's tied to them, it's
Yeah.
theirs. They can't get rid of it. But I think as a caregiver, it also becomes bound to you, and you could let go of it somehow, some way, but it doesn't feel right. I think it gets replaced by another feeling like guilt. For example, if I am going to leave her side to go eat a meal at Chipotle, for example, just some some random restaurant, like I would feel guilty because I wasn't with her and I wasn't in the pain with her. But as a parent, I felt like I needed to be in the pain with her. So it's like trying to take care of yourself so that you can take care of another person is a really tough catch 22, I think, for many people who are caregivers of others who are suffering. So having taken on her suffering by proxy, I think I've learned a lot of things about myself that um, are glaring deficiencies in my own part. Like for example, I was working at three different universities at the time, just because if you want to get a full-time gig in academia, you have to have experience, and it's impossible to get experience unless you just start off at the bottom of the totem pole. So I was teaching at like three different universities as an adjunct. And after she died, everybody was saying, take your time, take your time, take your time. And me being this person that wants to feel like I've got it all together, like, no, I got this. And I was back at it, 2 weeks later, back teaching my classes.
Mm.
Uh, and so I think looking back in retrospect, there are a number of things that I got wrong, but there are a number of things that I learned. So even though I got them wrong, I still use those as learning tools to shape how I do things in the future. But it's profoundly impacted the way that I understand pain and suffering, and bring that into the room when I'm working with other people, because I think all people are working with this crisis of identity most of the time. They're trying to figure out who they are. I have several advisees, supervisees, therapeutic that do therapy, and it seems like that comes up week after week as a theme that people want to know who they are within the context of their current situation. So, whether it's a 17-year-old trying to figure out her identity or a 44-year-old woman trying to figure out her identity, it's always being shaped and refined. And people, just a fundamental piece of understanding yourself before you can, quote unquote, improve yourself.
So when someone presents you with that and they say, I want to find out who I am, like how do you guide them to that discovery?
Yeah, I think there are a number of like strategies, interventions, techniques that can be implemented. And so, what I try to do with my supervisees is give them tools for their tool belt. I don't necessarily know that one tool is going to work in a given situation well until you're actually in it. But I think timelines are great as a tool to help people understand where they've been. Sometimes people hold on to these stories, and it's incredible who they haven't told. Like, you're the first person I've told this to, but this happened to me at age 13. And there's something really valuable about letting that information out to another person. It's one thing to say it to yourself, but it's something else because, again, this goes back to being created to connect. There's something about being able to take that from where your memories are stored into the verbal side of your brain, let it out, let somebody else experience it, let them be broken with you. That's where transformation and healing really
Mhm.
starts to happen. And I think when people hide these things, or whether it's latent or purposeful or not, whenever people hide things, Brene Brown says that's where secrecy, silence, and shame, they are. It's just a breeding ground for those things. So shame can grow. Secrecy, silence, and judgment. That's what she says. Secrecy,
Mhm.
silence, and judgment grow in secrets. And so being able to have a place to let that junk out helps shame from taking over.
Mm. I started writing, like, immediately after my son passed away, and, I actually had him when I was a teenager. I was a very young mother, and one of the chapters that I wrote about was the story of his birth. He was an identical twin, and his brother passed away at birth, and, it was the first time I ever told that story,
Mm.
and I think part of it was because of my young age at the time when I became a mother, and, part of it was because of the grief of the what happened during that time. But, what you're saying about that, about the silence and the secrecy and the judgment, it's inside, right? I felt like for whatever reason, and now that I put that on paper, I realized that that ended up being the foundation for who I am today.
Mhm.
But for whatever reason, I had difficulty at that time, and I mean, we're all so judgmental of ourselves. We're all very good with beating ourselves up, right?
Mhm. Mhm.
No problem.
Absolutely.
Um, what are some of the most common roadblocks you see that that people put up? So, someone comes and they want to move forward, but they still haven't figured out how to move those roadblocks for themselves. So
Mhm.
how do you guide them through that?
Yeah, I think first those roadblocks have to be identified. I mean, I think there's an assumption that those roadblocks are fully known and well aware of them. It's just a matter of getting around them. But I think some people have blocks that they are not aware of. And so you have to be ready to change. So that's another going back to intervention piece of knowing where a person's at with their buy-in and if they are ready for change and to what degree are they ready for change. Are they in pre-contemplation mode? Are they ready to go at it and make the change? If they are, let's get to work. Let's identify the barriers together. I think that's often a collaborative process, but what's more universal probably between people is the fact that those obstacles sometimes they're self inflicted. They've been put there by other people, and
Mhm,
maybe social scripts have written those obstacles. And it's worth saying, no, these were created by my teacher or my dad or whomever, and
right.
say, um, to what degree are these true, and what degree do these serve me well at this stage in my life? Are they workable? Are they things that I even need to acknowledge? Can we just break that one down? I think the tricky part there is breaking them down a little bit at a time, because I think sometimes those obstacles that people put up for themselves serve as a buffer,
Mhm,
and that buffer serves as a defense mechanism that helps people feel safe. So if you go breaking down a bunch of barriers so that people can run the race and get to their goal, and you do it too quickly, that feels vulnerable. So
mhm,
being aware of the barriers, the purpose of the barriers that they serve, and then working to uh, navigate a plan to move around those barriers, I think
mhm.
is ideal.
And I mean, I guess some barriers, like with past, hurt or trauma, it's about recognizing them and facing them and kind of talking through them,
Mhm,
um, before you can go around them, like being able to let go of some of the internal judgment.
mhm.
Um,
And that really
with
drives like theoretical orientation even. So the therapist maybe is trained in or is comfortable with. So I've been around emotion focused therapists who, their whole goal is to help you process your feelings around situations in order to move forward. Um, Whereas a CBT still looking at feelings, but maybe puts a higher premium on cognition and behavioral strategies for getting around those barriers. So I think that is an important thing that you're saying, Kelly, for individuals to choose a therapist that seems like a good fit for them, um, even when it goes to theoretical orientation and who's comfortable with what.
Absolutely. Just back to the grief for a moment. For families who have lost a child, um, what are and I've read the stats about marriages and relationships. Um, what can you say, both as a practitioner and as a bereaved parent, about how families can approach this? I mean, it's a shattering experience for your life, right?
Yes.
And so how, as a family, can you stay connected and take care of each other through this difficult time?
Yeah, that's a great question. I think acknowledging the fact that those stats are real and they're real for a reason is step number one. And I think that our we within the hospital system that we were using for Marley's care, a psychologist came in to check on the family, and the psychologist worked with our older daughter, but she also worked with us minimally, not a lot, but I can still recall, like it was yesterday, her telling us most families aren't going to make it through this together. Like that, most families, there's going to be divorce, and so you all need to get your heads on straight that you're going to work together through this, and you're going to be partners through this. And
Mhm.
so I very vividly remember that. And even though it sounds relatively elementary or basic, it really shook in me like this need to make sure that I'm understanding of Nikki and her feelings, my wife,
Yep.
and that there are times which is very unique, and I've noticed this a lot through our experience. And just to be clear, Marley fought cancer for 2 years before she passed away at 3.5. So this wasn't like a short term. Like we were in this battle with cancer for 2 years and multiple surgeries and multiple. She had a stroke early on after one of her brain surgeries. There were a lot of health complications that Marley was working through that also made it challenging for my wife and me. But we had to recognize that oftentimes when Nikki was doing okay, I was down in the ground somewhere, just in
Yep.
extreme pain. And then when I wasn't, it's like we would flip. And it's really like the other person that was feeling relatively okay at the time would help the other person that was down. And so in that those cycles, we really leaned on each other. And I think that it's important to just, I think to answer your question poignantly, is to respect those statistics and be aware of them and understand we have to work at this. Otherwise, it's not going to survive.
Yeah. And because men and women grieve very differently, don't they?
Oh, yeah. Yeah, absolutely.
Yeah.
Yeah.
So, and it's important that we understand that different is not wrong. It's
Mhm.
just different.
Mhm.
And that was something in terms of our family experience that therapy really helped us with that.
Mhm.
Recognizing that because my husband was not expressing emotion in the same way that I was, that didn't mean that his pain was any less than mine.
Mhm.
His expression and how he worked through grief might be him out digging in the dirt in our yard, right? That's maybe how he was working through his emotions. Um, but therapy for us, I believe, saved us,
Mhm.
really. It allowed us to have autonomy in our experience. So not only, my own personal experience where I could talk to somebody um, openly and honestly and things that I was frustrated with or anxious about, but my son could also have his own individual experience with a therapist
Mhm.
that was focused on where he was developmentally. So he was about 12 years old at the time. And I always used to laugh because he would come out in the car because he had this experience by himself. And he would get in the car with me after and he said, I don't have to tell you anything about what happened in there. And I
Mhm.
was like, you're right. You don't, because that is your space. And we had such great trust with the therapist. Can you speak to that, the value of therapy in a situation like this?
Yeah, absolutely. I think just the like when I go out to coffee with friends, like we are talking about content usually, and then oftentimes the process gets ignored or just getting deeper into things. And I think some of that's just socialized into us. Like there's sort of a healthy boundary of where I let you operate. And if you don't want to go deeper, that's fine. But you also don't get pushed a whole lot either. I have some friends that will push me, but above and beyond, most people don't. And I think that's where therapy really picks up where those friendship coffee chats let off, is that there's a goal, there's or a number of goals that you're working toward, and the therapist can help nudge you back in, because I think again subconsciously sometimes we get uncomfortable and we want to move away and start talking about something different or change the theme of what's being said.
Mhm.
But staying in the pocket and talking about what you came to work through, and processing and thinking through the process is something, especially in the silence, that we don't do well in engaging in regular conversation. So it's very goal directed. And I think that even just not paying attention to the data on CBT, for example, because a lot of study designs are oriented well for cognitive behavioral therapy. I think that anecdotally, people say like therapy is really what helped me get through. And it's because I was able to process my feelings, my emotions, have insight about things that I didn't realize were there before, but also do it in the context of a healthy relationship. Going back to polyvagal theory, there's this piece about like you can't necessarily think your way through problems and situations. Sometimes you can. Sometimes you can develop strategies. You can put a T chart together and go through those thoughts. But really, there's something profound that happens with being able to um, share with the other what's happening inside and make sense and organize that information in a way that has to be verbalized. There's so much
Mhm.
information that I process that doesn't get verbalized, and in that, it gets lost. And um, therapy just helps with that process of allowing memories, emotions, sensations, images, thoughts to come out. Uh,
Mhm.
and That's the beautiful part of it.
So this podcast is really about stories. It's about people telling their stories with the hope that, a listener who's out there who needs a little boost or an idea might receive a bit of wisdom. Um, what's your feeling about storytelling and how that can heal our communities?
Yeah, I think we're again wired to hear other people's stories too. I think that's why there's such a general interest in scrolling. Even I mean, you look at this phenomenon of people just using their thumbs to move from story to story to story, and they're absorbing so many stories in a way that really our brains aren't handled or capable of holding those kinds of stories. They're one-way stories for one. They're not
Yes.
bi-directional.
Mhm.
They're just and they're loaded to be a dopamine hit. So it's almost like a taking advantage of storytelling when social media can take a really nuanced story and put it into a 5 to 15 second clip with music behind it and the whole 9 yards. It makes me worry about my 12-year-old son who I don't let him do social media. He doesn't have a cell phone, but what is he consuming? And is he going to have the tolerance or the threshold to hold other people's stories in a way that we're meant to sit here and talk? Like to be able to sit down and talk to somebody for 20 minutes and keep eye contact and do that successfully in ways that move us as people forward, or do you chase after the dopamine hit and scroll, um,
Mhm.
and lose those skills and abilities to do that. And that's, I think, a scary place for us to be. But I think that's where we are. I was forced to go into this technology fast for work. This was only a week ago, but my boss took us all out to this retreat center. There was about 5 of us, and said, we're just going to leave our cell phones and our computers in the car, and you can't mess with any of them for 24 hours. And I thought, that's such a good idea. This is a good thing for other people to do, and I'll just participate. And I was about to hit my head against the wall after a few hours. Like, I am one of those people, but I didn't realize it until sitting there and sitting through it. And my mind would catastrophize about things happening while I was away, and these things that never would have happened 20 years ago when cell phones weren't around. Like, we didn't have a phone. I didn't have maps. I didn't have music. All of these things were really ingrained into my brain within the last 20 years. And so that part of it, it scares me. But I think I've strayed from your original question a little bit.
No, all good. Because I kind of equate social media, and I mean, I have a social media presence online. I have a large gratitude group. I teach growth through gratitude, building resilience through the use of gratitude. And but sometimes when I get into the habit of scrolling, and I'm guilty of it, it almost feels like drinking through a fire hose. There's so much information coming at you at the same time, like all within the span of a minute. You can see globally, 20 different stories. And you're right about that growing mind of a child, and how they take that in and process it. That is concerning. And we as parents, we have to speak up a little bit. I mean, I grew up in a time where not only did we not have cell phones, we didn't have computers. So
Right.
I remember the first computers that came into our school, and we were, I think we could print something on that data processor, and no internet. I'm dating myself, but we grew up in a time where I remembered everybody's phone number. I retained information, directions. Like, we've lost that ability to really have that complete focus. And I think that's something that if we want to have true community and unity and be able to help people, we have to look up. We just
Absolutely.
have to look up.
Absolutely.
Yeah. So, if you could recommend one book for listeners who want to build their own resilience and grow hope, what would it be?
Yeah, well, I think we've already mentioned the anxious generation, how that's been helpful. But
Yeah.
as far as growth, I mean, Carol Dweck has probably the most prominent forward-facing storefront kind of presence in terms of growth mindset, and that would probably be like her, seminal work in growth mindset would probably be it. Uh,
Mhm.
so
Yeah.
I do think there's a lot of that on. I'm not in social media either, so I get what you're saying. With LinkedIn, I am, and I see a lot about positive and negative growth mindset, but I think putting it into practice is something different. And one of the things that we were talking about in a meeting yesterday, I think I get this like a clear example is a student emailed me the other day wanting to know when their paper is going to be graded, but the grammar was not right and the punctuation wasn't there, and like things that drive professors crazy, right?
Mm.
And so your mind switches from this question of what's the matter with this person to what happened to this person, I think is a fundamental shift for me as an educator. It's not
Mm.
necessarily that that person doesn't know how to write. This person could be at the bedside with technology of her mom or dad at the hospital and is just trying to shoot a message off to me real fast and could be in a whole host of troubling circumstances. And I think giving grace to that is helpful for me as an educator. It really moves
Mhm.
me from a place of why can't how am I going to pass this person who can't even write a coherent email to what happened to this person. I think that that's true for people with traumas and a whole bunch of other things. Like they're coming from a context that I'm not necessarily focused in or paying attention to.
Mm. I love that. What happened to this person? It completely changes your perspective.
It does.
And it kind of reminds us that, we all walk into situations and stuff's happened to us as well. And we hope that we get that grace.
Mhm.
Um, Before we close out, I just want to talk a little bit about gratitude. So, I have this global gratitude group called Just One Little Thing. And I started this practice, as I said, shortly after Stephen passed, finding one little thing each day to be grateful for. We did it as a family.
Mhm.
Did not change the pain of the loss. I just want to say that right now, it did not, but it did alleviate some of the suffering. So each day we would look for one little thing because one little thing would keep us in the present moment. When you're actively searching for things to be grateful for, you're in the present moment. So we weren't thinking about the regrets of the past and we weren't worried about the future. And we were right here, right now, and we were okay.
Mhm.
Um, but our one little things were not typical gratitude journal content. Like one little thing for me one day would be that I was able to walk to the mailbox without bursting into tears.
Mm.
Um, One little thing for my husband was a butterfly that landed in the garage. And we always look at butterflies and dragonflies and all those symbols of hope after loss. For my son, we did role playing with him before he went back to school after Stephen died so that he would be able to navigate situations. And so if he came home and had a great day at school and felt normal, that was a big thing. So we did that every day. And every day, those things, we tethered them together and they brought us back to a place of light.
Mm.
Um, so each day I continue this. This is still my practice, and it's also my celebration of Stephen and Matthew. Um, so my one little things for today. My sister is visiting from Newfoundland, Canada, so I get to hang out with her after I leave this interview. Um, and this conversation with you, it's just I've learned so much, and I think you've left our audience with so much wisdom. So, what's your one little thing today?
Yeah, one of the things that struck me when I was going to visit Marley at the hospital, I was driving down the street and someone was working really hard to get down the sidewalk. I mean, it's like you could tell that they had pain, that they had some things that were keeping them from walking upright and moving fluidly, but they were still getting out there and trying. And I think that that is one of those things that it still sticks in my mind today of like if I just keep moving forward, like that's progress. And not every
Mhm.
day am I going to feel like conquering the world, but I think every day I'm reminded how time is short and it seems like we go through waves of losing people in our lives, of that happening. And I just have to be grateful for the time that I have here and now, and and try to be productive too. I think that there's a big pushback or this culture of like of 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 like a toxic workplace and working too much, and I totally get that. I want to help fight the fight on that. I also want to make sure that I'm giving my best too. So I want to make sure that while I have time on earth that I'm making an impact. And so that's part of what agreeing to be on here and just wanting to share my story, even if it reaches a few people. I think that's hopeful. I'm doing the work and you're doing the work. And I think that this is all an example and testament to that. So my one little thing is just getting out there, and I'll be taking the dogs for a walk today. And I think that'll be just a little thing, but it will boost my mood. It'll help the little furry friends upstairs, and they'll just make it a good day. It's a beautiful day. We're here where I live, and I hope it is where you do too. But
Oh, it's gorgeous. Yeah.
getting outside is awesome for me and
Yeah.
my
And dogs are such great teachers of unconditional love, aren't they? I mean, they love you no matter what kind of day you're having or your behavior, or
yes,
they just, I love going out for about a half an hour. When you come back home and the dogs, it's like they haven't seen you in 10 years.
sure.
It's just a great feeling, right?
That's right. That's right.
So, before we close out this fantastic discussion, I just want you to tell our listeners how they can connect with you and learn more about the work that you're doing.
Yeah, so LinkedIn is probably the best way to catch me. I do have a presence through my work, school I work at, but I'll leave the name of that out of here. Neural Pathways Learning Center is another way to be able to look me up. But yeah, LinkedIn. I think it's Brent Moore, PhD, and then you can always just put a message into me and be happy to connect with folks. So.
That is great. Brent, thank you so much for such an
Yeah.
honest and beautiful conversation. I'm just so grateful to you. And I hope you'll come back again and maybe talk a little more with us.
Yeah, you bet. Thanks a lot, Kelly. I really appreciate your time.
Okay. All right. And keep looking for those one little things.